Remember that I published a video about the state of health and safety practices in so many companies in Nigeria using song water as a microcosm of the larger space. While people are dying on a daily basis, we also continue to go to our various workplaces without even understanding the impact and how this can affect us one day somewhere where we do not even plan, or when we do not even know it could happen to us. Strategically, we continue to endanger our lives by not joining forces to address these issues. That particular video is not only limited to the factories, but if factories that has high level hazard and major risk could be lackadaisical about the health and safety of workers, and the Ministry of Labour and Employment is absolutely doing nothing about it, and not to talk of every other organization with low perception about health and safety. Again, we need to have a separate ministry for safety and sustainability. Yet another major accident of the thousands that happens on a daily as a result of the carelessness of the management and the responsible regulatory body happened again, but this time at the General Hospital in Lagos Island. A young medical doctor identified as Nwahere, I don't know if I pronounced it well anyway, lost alive in an elevator accident with less than 2 weeks left to complete her housemanship. This report aims to shed light on the incident, analyze the possible causes of the accident while we discuss about these causes and the various preventive measures that should have been in place. This report was fully established by HSC Nations, like I said earlier, the organizers of AfriSave and Omis Award. And that reminds me, AfriSave is coming up very soon. Be ready to get your ticket. It's a great opportunity to learn, to connect in a glamorous atmosphere. See you there. Now let's go back to business. According to the report by HSC Nations, this elevator on which the victim was riding fell from the 10th floor to the ground floor while she was on her way to pick up something from a dispatch rider outside the hospital. Wow, Nepal. Sorry, let's continue. The alarming nature of the incident was further compounded by the alleged delay of 1 hour before the body of the victim was evacuated and rushed to the emergency, eventually leading to her death. This is a great issue. And when we keep shouting and screaming about deliberate safety practices, engagement of safety professionals in your organizations, in your schools, in your estates, in your commercial buildings, offices, hospitals, banks, building complexes, shopping malls, market, and many other places for public and private use, you think we are being too careful. You think we are saying too much. It takes a single accident to ruin your organization. It takes a single accident to kill someone. It takes a single accident to rot in jail. It is never too late to do so now. This accident is one of the series of accidents that could happen anywhere, anytime if proper deliberate measures is not in place. Engage a safety professional now in your organization. One of the major concerns highlighted by HSC Nations in the aftermath of this tragic accident is the prior knowledge of elevator issues within the hospital. According to some tweets from their staffs, several complaints about the malfunctioning elevator has been raised in the past, but no significant action were taken to rectify the problem, and there was no government body to inspect and enforce correction. I do not know if this organization is registered with NSITF, because if they did, I'm very certain that they will have noticed this, noted it, and advised the company. That is the only government organization that is actively working when it comes to health and safety, among some others. I do not know. You can check them out to register your company with them. You would definitely love to work with them. Now let's go to the possible causes of the elevator accident. Number 1, lack of maintenance. One of the primary reasons for the tragic elevator accident could be the lack of regular maintenance. Elevators are complex mechanical systems that requires frequent inspection and upkeep to ensure their safety and smooth operation. Neglecting maintenance may lead to mechanical failures contributing to the accident. Another one is inspection. The hospital administration must implement a strict maintenance schedule for all elevators. Routine inspections by certified professionals should be conducted to identify and address any potential mechanical or electrical issues promptly. Now, let's talk about immediate reporting and response mechanism. All staff members should be encouraged to report any malfunctioning or irregularity noticed in elevators immediately, or any other safety issue. A dedicated response team must be established to address this concerns promptly and efficiently. Now, safety trainings. Hospital staffs should receive comprehensive safety training that include proper elevator usage, emergency procedures, and evacuation protocols. You need to train your workers, your staff, on health and safety generally. This knowledge will help in handling health and safety challenges with your employees, with your workforce, and that will help in promoting a safe workplace. Now, before we continue, for your HSC trainings, health and safety trainings, HSC support, developing and implementing HSC management systems, developing safety programs and processes to improve your health and safety practice and prevent accidents like this, you can reach out to Cordal Safety Consult. We are your best source for any challenges you have with regards to health and safety in your workplace. We have delivered so many trainings, we have helped organizations to improve their safety culture, and we can definitely replicate that and do that with you also. For further inquiries, you can reach out to us via the details on your screen. Now let's go back to class. Another possible cause is the absence of safety features. Modernizing existing elevators with safety measures such as emergency braking system, backup power supply and alarm can significantly reduce the risk of accident and improve response time during emergencies. Now, transparent communication, which was lagging. Hospital management should prioritize transparent communication with employees regarding safety concerns and measures being taken to address them. This fosters a culture of trust and accountability among staff, and that will also improve workplace productivity because the workers believe that yes, you care about them, but otherwise that duty of care is not there. Now, to determine the exact cause of the elevator accident would require a thorough investigation by relevant authorities. However, potential factors like lack of maintenance, poor repairs, inadequate safety measures, safety features, and improper usage could have contributed to the unfortunate accident. Addressing these possible causes and implementing preventive measures will be crucial in ensuring the safety and well-being of everyone who uses this elevator in the workplace and beyond. This is another wake-up call for everyone, every professional, every learning person, every practitioner, every single citizen. Let's prioritize our safety and the safety of our environment. It might be you tomorrow, or it might be someone else tomorrow. Don't say God forbid. Let's start working towards it. Faith without work is dead. See you in the next video.